What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, January 13th, 2024. It is a very busy Saturday. We have a ton of news stories. If I could show you the tabs on my pandemic update screen here, you'd be like, wow, we have to get through all that within a 15 to 20 minute video? Yeah, and we may even skip over a few things today. There's just that much to cover today. First off, if you're new to my channel, this is where we do the daily pandemic update on not just COVID, but as you can see, our first story is going to be about measles. So we talk about a whole array of different viruses to help keep you safe and to keep you informed of what is going on. Because let's face it, there's not much coverage in the media. Yes, we're starting to see a little bit more coverage of long COVID, but all these different viruses deserve a news program of their own. That's where I come into play. So if at the end of these videos or this video, you like what you see, give it a thumbs up and subscribe to my channel down below. And if you have anything to say, leave a comment. I'm more than happy to read it and respond to it. Measles case confirmed in Camden County, New Jersey. Now, we actually have to do a little reversal here, but let's go over this first and then we'll reverse. Officials know the infected person went to Cooper University Healthcare Pediatrics in Voorhees, New Jersey on January 5th between 11:35 a.m. and 2:32 p.m. And the emergency department at Jefferson South Stratford Hospital on Laurel Road on January 8th between 8 p.m. and 12:38 a.m. If I have any followers in New Jersey that may have been to those facilities, please take note of those times. Now we have to reverse a little bit, and I have now created a thread archived on my site where we're tracking this, where we're documenting this. This actually stems back from something further, and you may have heard me talk about this in the past at the end of December and the beginning of this year. This actually started with exposure at a child care facility in Philadelphia, and then it led to a exposure at the Children's Hospital of Philadelphia, then St. Christopher's Hospital, then it spread to Montgomery County, Pennsylvania. You've heard me mention Montgomery County, Pennsylvania many of times before. It's a suburb of Philadelphia. We take a look at their CAD in almost every pandemic update. And yes, this is something that is a problem, and I want you to take note of something. All these sources here, two of them at the end, come from the CDC. I did include some information on measles in the sense of incubation period. It's a 10 to 12 day incubation period. Rashes can take up to 21 days to occur. Therefore, I don't think we're done with this yet. I think we're going to see more of this pop up. I got everything documented here, and of course, as we find out more, I will be adding to this. And if this starts happening in other cities and metro areas, I may have to start more threads. I'm hearing rumblings that Washington, I believe it was Washington, D.C., there may be a measles outbreak starting up there as well. Haven't really investigated it yet, but I will take the time to investigate that. And of course, I'll bring you any information on that as well. All right, moving on. We have a lot more things to get through. We're just going to read a headline here. If you want to see this full story, you can check it out. I tweeted it. 2 British Airways cabin crew members die while on duty in separate incidents. We're seeing this with airlines all around the world, where someone passes away, dies unexpectedly, sudden medical illness or sudden medical emergencies with pilots, with crew members. I mean, it is happening, and it's happening more frequently, and it is not normal. All right, moving on to the next story. By the way, you may hear some wind in the background. I can't control the wind. It is super windy here. Big cold weather is moving in. We've had gusts well over 30 miles per hour here today, and you can hear the wind howling outside. All right, moving on to Vermont now. RSV and other illnesses are crowding emergency rooms, health department warns. RSV, flu, and COVID are all on the rise, the department said, putting a strain on healthcare facilities. You may remember, Vermont used to be one of the best states during the start of the pandemic. They just did great. Then, as time went on, when they opened everything up and everything moved on, Vermont didn't do so well. Got a little better by a population perspective. Yeah, I mean, they're still doing pretty good, but now that RSV and other illnesses are catching up there, because remember, RSV and flu and other respiratory illnesses surged first in the south and then up north. COVID started in the northeast first, and now you're getting a mixing of everything, and the emergency departments are getting busy. Let's read a little more. A surge in respiratory illnesses caused increased patient volumes and long wait times at Vermont emergency departments this week, according to a health update from the state department. So Vermont State Health says, hey, it is increasing at this time. Now let's move over to Texas. Lubbock, Texas. Public Health Department is saying that their numbers are increasing. They increased after the holiday. It's flu, COVID-19, and RSV, according to their experts. And it does not stop there. Metro hospitals see longer than normal ER wait times amid surge in COVID, RSV, flu. This time we're referring to the Twin Cities. And yes, within this it does say that masking is coming back in place as cases are starting to rise. Here's my thing with masking coming back. I think I mentioned this before. It's worth mentioning again. A lot of places across the U.S. in healthcare facilities are starting to bring back masks. That's great. But once the cases go down, could you do us a favor? Leave it in place? Cases going down with masking going into place is a sign that, hey, masking's working. It's preventing cases. Good. Keep it in place. Keep the cases down. Because oftentimes when the masking gets taken away yet again, you know what happens? Cases start circulating. Now they don't see a big increase, but they start circulating again. That layer of protection, you know what? It's a good thing. So leave it there. What's wrong? What's the harm in having a layer of protection in place? All right, moving on to this now. Broadway's Appropriate cancels January 12th performance. Sarah Paulson out with COVID. Again, we're just reading a headline. If you want to read the full story, you can go to my Twitter page. All right, we have several things from Twitter now. Dennis, the COVID info guy, has tweeted this about Italy. Yeah, we haven't talked about Italy in a while. 20,945 cases and, wow, 355 deaths from the 4th to the 10th of January 2024. New cases, so they actually dropped. Deaths actually dropped 4.3%, but again, you get the idea here. They're still having 355 deaths in a week. That's a lot of deaths. That's just one country. That's a country much smaller than the United States. They still have 5,131 people in the hospital. Again, a country much smaller than the United States. Next, we come to this. This is something I'm going to try and include almost every day. Yesterday, we were out in the wild, so I did not mention it. I should have mentioned it. Mandy Cohen has not tweeted in a while. She finally did something yesterday, but it really wasn't a tweet of her own. It was from the actual CDC. Mandy Cohen is the CDC director, in case you don't know, and she retweeted this. What impact could high levels of COVID-19, flu, and RSV hospitalizations have on our healthcare system? See how the CDC is monitoring hospital capacity. I mean, she retweeted that. She didn't tweet anything about masking recommendations, what you should do. Hey, this is our second biggest COVID wave ever. No, nothing like that. I don't know what her deal is, why she is just not on the ball. She should be tweeting continuously. I also noticed here I do not have the Surgeon General followed. Why is that? I don't know. Or the FDA. So let's follow that. All right, moving on. I tweeted this poll out last night. If you have had COVID, do you find that you are continuously getting sick now? It's a fairly simple poll question. I wasn't expecting this to be a high number. I didn't think it was going to be over 50 or 60%, but it was 38%. So, I mean, out of 466 votes, that's a good number of people. It didn't get a lot of votes. We've had some other polling that has gone over 2,000-3,000 votes. So, I thought this was a rather interesting question. Let's just read some of the responses. Bree put, no, but I mask everywhere and haven't seen anyone unmask since Memorial Day. Not sure what that's all about. No one has unmasked? Okay. And then you come down here to, no, but I wear a respirator everywhere. And then someone else said, tomorrow, my husband had COVID and we are still masking everywhere. He hasn't been sick since then. You're seeing a lot of people that's saying they're masking and that masking is preventing them from getting sick. Josh Sherwood said, yes, mostly because my kids bring it home. and then we come down here, one left socky. After I caught COVID, I realized that it was serious. As having hallucinations and feeling of not being able to breathe do, and then I began masking and using nasal spray. So that's a good thing. Nasal spray is a good thing. I actually use Flonase. It was recommended by my pulmonologist to help with my post-nasal drip issue. This person said, JJ says, I have gotten one cold in the 2 years since I had COVID, and I have a kid in 6th grade in public school. Never stopped being sick post-COVID. Here you go. Here's one. And we could go on and on here. You get the idea here. The general idea is if you mask, it works. If you wear the proper type of high quality mask, it does prevent COVID infections. All right, one more thing before we get to some data, although I would say this is some data. There is more COVID-19 transmission today than during 96.5% of the pandemic. Remember, we are at the second highest wave of the entire pandemic. A pandemic that has not ended. You can say it's over all you want. It hasn't ended. It's not endemic. I won't call it endemic because, again, it's the second highest wave of the pandemic. How is that something that's endemic? It's still hitting really high levels. It's 96.5% more transmission than any other point. That clearly is a pandemic. All right, let's take a look at some air quality values for today. And we see that air quality values across the country are not too bad. Bad on the west coast. It's fireplace season, but in the east, you can see here not too bad. There's a few orange and yellow sites here and there, but look at the southeast. Really good air qualities. You haven't seen this good of air qualities in some time, and I can tell you there's going to be some really cold air coming in. At some point this weekend, we're going to do some sort of a climate video on our other channel, at Climate Data Report, and there is a link to that down below in this video. We're not going to look at any of this wastewater data because tomorrow is wastewater day. We dedicate Sundays to the wastewater update. I may also add a few news stories if there are any, because it's been a very busy news day as is, as you saw. We just went through a ton of news stories. National positivity at Walgreens is 28.1%, and that is with a slight decrease in testing, 35,688 versus 39,000. And I think testing's probably going to continue down at this point because the holidays are open. No, I get it. Martin Luther King weekend, yes, it is a holiday, but it's not a major holiday that requires people to rush and get tested because they're going to gather like they did at Christmas and New Year's and all of the other holidays. All right, moving on here. We can see deaths are rising in some states. Pennsylvania, New York, Maine, New Hampshire, Virginia, North Carolina, Delaware, Maryland, and then they're rising a little bit more significantly in Kentucky and Oklahoma at this time. Then you also have rises in Mississippi, Arkansas, Missouri, Iowa, Minnesota, and in Wisconsin, and we suspect this will continue in more states because, again, remember, deaths are always the last lagging number in a wave. Taking a look here at the epidemic status, you can see it is still growing in some states. It's declining in a few states now. Ohio and North Carolina and Massachusetts are now starting to decline. Remember, nationally, this week was the peaking week. We're going to start to see national numbers drop, but some states will still rise. California could still rise to Pacific Northwest. Some of the southern states are still rising. Again, remember Texas this week, or if you did not see, I'll show it to you real quickly at the end of this video. Texas did have an increase in cases this week. Taking a look at hospital admissions, they still went up by 3.2%, 35,801 hospital admissions in the past week. Philadelphia had 790 EMS incidents on Friday. Live looking at the suburbs, and it's a good thing. You can see Montgomery County right now, only a total of 9 EMS incidents. That is a good thing because, hey, they were in the 20s there multiple days in a row at the peak of the wave in southeast Pennsylvania. Taking a look at Chester County, real quickly, going back to Montgomery County, I want to point out something. Look at all these vehicle accidents. Now, there's some road obstructions as well, but look at all these vehicle accidents. I've pointed this out before. Ever since COVID started, there have been way more accidents. Is it because the brain is not reacting from people who have long COVID or brain damage from COVID? something for you to think about, something maybe you want to comment on down below. We've talked about it before. Chester County, again, not doing that bad right now. It is low call volume today. Same with Lancaster County, although a bit busier, but I have to tell you here, their calls, they do lag. The ones on the bottom are fairly old, but the most recent calls, again, not doing too bad there. New Jersey, 1,295 hospitalizations, 58 people on a ventilator. The ICU levels, they are still a bit high, 182 actually. I think ICUs actually went up a little bit today, but hospitalizations overall, they are dropping now, and 69 out of 70 hospitals reported today. Next couple of days will be less. It's a holiday weekend, and well, the past couple weekends have been lower. 243 discharges. That's quite a few people discharged. But again, that ICU number is not good, so they may have a death wave pretty soon. Let's see if we got anything out of New York State. I don't know that we actually will. Okay. 5,632 cases. I think that's the same number from yesterday. And their current hospitalizations, I do have to refresh this and zoom this back in. Their current hospitalizations are at, let's see here, 3,058. All right, as promised, here's Texas. Texas this week, cases did go up, which is why you saw the levels were still increasing there. Current week, 17,173 versus 16,427 the previous week. That is up by 746. And then we come down here to hospitalizations. 205 increase. 1,950 versus 1,745. And deaths, they did go up by 3. 43 versus 40. All right, skipping now over to California. We have to refresh this. California did update this week. And with that, we do see hospitalizations in California are actually dropping ever so slightly. It looks here like the average daily rate of deaths, or the average daily deaths due to COVID, are starting to rise here. Influenza, look at that. Looks like that is starting to, or tests for that are starting to drop. Hospital admissions have dropped for it. But take a look at this. Influenza deaths, they are starting to rise, and that is not a good thing to see. All right, finally, ending today on this week's flu update. We continue to see very high levels of flu in Louisiana, Tennessee, and South Carolina, and also in New Mexico, where it is at the highest shade of coloring here, which is purple. But there are some other places that are very high. Texas is very high. D.C. is high. New York City is very high. California is very high. Florida is high. And you can see here, there's also Georgia and Alabama are at very high levels as well. And you can see when we take a look at New Jersey is also very high. And Tennessee, as mentioned, is very high. You can see it's a general mixture across the country, but we're starting to see more red and orange fill in the north, and I think in the north that is going to continue, and the purple levels in the south, I would hope pretty soon, maybe start to dissipate. I'm surprised we do not see purple in New York City. Don't be surprised if it does pop up again soon. Alrighty folks, that does it for the Saturday edition of the Pandemic Update. We will have another update again tomorrow where we will focus on wastewater. If you have learned anything in this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see this content, by all means share this with them. If you have any comments on all the stuff we talked about today, we covered a ton today. It's a very busy news and data day. By all means, leave a comment down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday afternoon. Thanks for watching.